Watch for other accompanying symptoms like irritability, decreased feeding, and fatigue with a fever. Call the doctor right away if a baby under 3 months has a fever. Lethargy. Babies are typically very interactive, wiggly, and vocal. If a baby suddenly becomes much more sleepy, less engaged, or has a hard time waking up, it could indicate an infection or illness. Leaning away from their surroundings and decreased eye contact are other warning signs. Seek medical advice right away if a baby's behavior changes dramatically and lethargy persists for more than a day. Vomiting. While occasional spitting up is normal in babies, continual, projectile vomiting or vomiting accompanied by excessive fussiness or fever requires medical attention. Vomiting can indicate a virus, medication side effect, diet intolerance, or potentially serious gastrointestinal issue in babies. Notify the doctor right away if a baby is vomiting severely, struggles to keep down liquids, or shows other signs of dehydration. Diarrhea, loose, runny stools once in a while are common in breastfed babies, but constant diarrhea for over a day is cause for concern. Diarrhea can quickly lead to dehydration in infants. Notify the doctor if a baby has more than 6 watery, runny stools in one day, especially if accompanied by other symptoms like fever, lack of activity, and decreased appetite. Diarrhea that contains blood or mucus also requires prompt medical evaluation. Breathing problems. Watch carefully for changes in a baby's breathing pattern. Signs of trouble may include difficulty breathing or taking breaths, breath holding followed by rapid breathing, wheezing, and noisy breathing. Have the baby evaluated immediately by a doctor for potential conditions like respiratory infections, asthma, or fluid in the lungs. Babies can deteriorate quickly with breathing issues, so do not hesitate to call 911 in emergency. Rashes. Most rashes aren't cause for concern, but some can indicate serious medical issues in babies. Notify the doctor right away about any new or changing rashes in babies, especially those that appear suddenly, spread quickly, feel hot, have open sores, or are accompanied by other symptoms. Rashes can signal conditions like meningitis, Fifth disease, and viral infections in babies. In summary, any dramatic changes in a baby's behavior, activity level, or body functions could indicate an emerging health concern, so parents need to be alert. While most minor issues resolve on their own, medical evaluation is important to identify and properly treat more serious conditions in babies. By recognizing and promptly responding to key warning signs, parents can prevent minor issues from becoming major health problems for their little ones. Stay observant but don't panic. Seeking medical advice early and following a doctor's guidance is the best course of action if parents notice anything unusual with their baby's health or well-being. As a parent, it's important to be aware of the warning signs of a baby's health. Early detection of health problems can help to prevent serious complications and ensure that your baby receives the care they need. Here are some warning signs to watch out for. High fever. A fever is a common symptom of illness, but a high fever in a baby can be a sign of a serious infection. If your baby's temperature is over 100.4 degrees Fahrenheit, 38 degrees Celsius, it's important to seek medical attention. Difficulty breathing. Difficulty breathing can be a sign of a respiratory infection or other health problem. If your baby is breathing rapidly, wheezing, or struggling to catch their breath, seek medical attention immediately. Dehydration. Dehydration can occur if your baby is not getting enough fluids or is losing fluids due to illness. Signs of dehydration include dry mouth, sunken eyes, and fewer wet diapers than usual.